Brought to you by GTA. We start with you.
Back in early January to late December of 2020, the CDC lab gave Guam approval to submit COVID-19 samples for variant identification. Anne-Marie Santos, lab administrator for public health.
They require the CT value, which is the cycle threshold values, to be less than or equal to 28.
The CT value is determined using PCR machines. The lower the number, the stronger the virus.
CDC has to approve all the information that is in that metadata before we can ship. So we get prior approval for all the specimens and samples that we send.
However, public health is not able to tell what strain of COVID a sample may be when they send it off to the CDC lab. Acting Chief Public Health Officer Mbakwe explains that it's possible that the Indian strain may have already been on Guam prior to the 2 GMH doctors flying in from India, a COVID hotspot.
It's just the process. So we could have had the Indian variant, we could have had any other variant, but there's no way we can find out. So I think it's coincidental at this point that we had this 2 doctors test positive, and then we received this result. So it's coincidental.
Mbakwe emphasized that public health doesn't pick and choose which variants go off island, but is solely based off of the CT value. In terms of building the capacity to perform rapid testing, Santos says they're working with their CDC partners and lab advisors and have already submitted their budget and proposal for Public Health Lab to set up an ISEC 100 system, a sequencing machine that will improve the turnaround time for results.
We're going to be having that soon, hopefully. I'm not sure, hopefully by summer or before the school year starts for next fall.
To date, a total of 61 COVID samples have been submitted to the CDC for genome sequencing. 7 tests were identified as the California variant. Meanwhile, 3 cases of the UK variant were identified and taken from travelers tested at the government quarantine facility. Those travelers were then isolated in the government isolation facility. Reporting for Guam's News Network, I'm Tyler Matanani.